One of the most common complications in the NICU is a pneumothorax, and that makes sense given how many of the problems are respiratory in nature at that age range. And there are a lot of things that may cause a pneumothorax, but what you have to understand is that pretty much any intervention that's happening to the lungs, it's going to cause stress to it. And when you have babies so tiny, right? Some of these babies aren't even 1 pound at birth. It's very easy to cause something like a pneumothorax. Is so fragile. When we think about clinical manifestations of a pneumothorax, I like to categorize it in between, or I try to categorize into non-specific categories and more specific categories. There are some clinical manifestations that are going to be pretty much common across the board among the wide swath of respiratory problems, such as tachypnea, nasal flaring, retractions, oxygen desaturation. These are things that can happen for any number of reasons. So what are some of the more specific ones that are more unique to pneumothorax that will help us to identify it and just to understand how it presents differently? There are a couple different things. One is grunting. Grunting, when you think about it, is when you increase the pressure in your lungs by, during expiration, you close your upper airway, and you're trying to increase the pressure in the lungs in order to inflate the lungs. So when it comes to grunting specifically as a clinical manifestation, it's something you see in the context of your lungs collapsing. So that's fairly specific. It's helpful. Something else is sudden or persistent oxygen desaturation. I mentioned oxygen desaturation under the non-specific clinical manifestations, but if it's sudden and persistent, that gives you an idea of like, okay, there's something else going on here. It's not just a gradual trend, something acutely happened. Very important to be aware of things like that, right? Sometimes it's not so much the specific value that's important, it's the trend and how we got there. Another thing would be a shift in the point of maximal impulse for the heart and hypotension. To illustrate that, because I feel like those two things can be a little bit more difficult to understand, I want to share a few diagrams, which I hope are helpful. The first is this is just a normal person, and they're just, even a normal person has just the lungs and the heart they're sharing the same space, right? And so the thing to understand about this is that your body is a zero-sum game in terms of real estate. Different things in your body are fighting for space. When you think about a very simple example of this, something that you may have experienced recently is what I call post-Chipotle burrito syndrome. It's when you eat so much that it feels actually hard to breathe. And that's because your stomach contents, your abdominal contents are actually pushing on your diaphragm. And some of the space that your lungs usually use in order to breathe is now being taken up by the Chipotle burrito. So moving on, think about bag valve masking, right? When they ask you to do the bag valve mask on your patient for CPR as part of your training, and as I know you all did, how much pressure did they ask you to put it in? They said just enough for chest rise. But you might be asking, well, what's the big deal, right? Giving too much air to somebody, how can that be bad? It's bad because this is what happens. You inflate the lungs so much that the heart gets squished, and we're trying to. I mean, the person doing compressions is working really hard to try to bring blood to the heart, try to pump it through the body, but you're pretty much getting in the way of all that work by hyperinflating the lungs more than necessary. So that's a way that you can think of these two organs as competing, the lungs and the heart. When a pneumothorax happens, what happens with that hole in the lungs, right, is that air starts rushing out into the pleural space, and as that starts happening, you're going to notice that the contents of the chest get kind of shifted over, right? If I kind of switch back between these two images, you see how the pneumothorax has kind of pushed over both lungs. It's also pushed over the heart. This is why you have a change in the point of maximal impulse, and you have hypotension, and on top of that, this is why your lungs are collapsing. So I just wanted you to understand that the hypotension is a very important part of pneumothorax, and something to be very, very careful about. We're worried about the cardiac output of our patient, and this is the reason why. In terms of treatment, the treatment options are pretty much the same between adults and children. There's air trapped in the pleural space, so we have to poke a hole ourselves from the outside and get it out. So chest tube, chest drainage, all that is pretty much the same.